The hallways of Grandview Hospital gleamed under the bright white lights, yet the atmosphere inside felt cold. Emma Carter pulled her white coat tighter around herself, taking a deep breath before stepping into the VIP ward. Today was her first day working at this prestigious private hospital, a place reserved for the wealthy and powerful. She had spent years earning this position. For a nurse from a small rural town with no family connections or industry ties, getting accepted into Grandview was nothing short of a miracle. But she also knew that places like this were not easy to survive in unless one learned how to adapt. They will be watching me, evaluating me. Emma tightened her grip on the patient files in her hand. But I don't need to please anyone. I'm here to do my job. The first name on her patient list was Richard Hayes, 72 years old. His file stated that he was experiencing complications after surgery and required close monitoring. There were no special notes, but one detail stood out to Emma. The patient had no accompanying family members, and there was little personal information in his file. She knocked lightly before pushing the door open. The VIP room was spacious yet devoid of warmth. Mr. Hayes sat by the window, slowly flipping through the pages of a book. As the door creaked open, he lifted his gaze. His aged but sharp eyes scanned her from head to toe. Good morning, Mr. Hayes. Emma kept her tone calm and professional. I'm Nurse Emma, and I'll be taking care of you today. He did not respond immediately. Instead, he observed her a moment longer, as if assessing something. You're new. His voice was deep and slightly hoarse. Yes, sir, Emma smiled, stepping forward to prepare for his blood pressure check. Mr. Hayes remained silent. Watching her, his gaze gave Emma an odd feeling, not exactly distant, yet not entirely welcoming either, as if he were harboring a secret or scrutinizing her every move. The room fell into an uneasy silence. Only the ticking of the wall clock could be heard. Just then, the door swung open with a sharp bang. Emma flinched and turned around. A middle-aged man strode in, his white coat crisp, his demeanor exuding arrogance. She recognized him immediately, Dr. James Mitchell, the head of internal medicine, the man everyone warned not to cross. His eyes flicked toward her before he smirked slightly. You're the new nurse. Emma nodded, maintaining a respectful posture. Then remember this. Dr. Mitchell's voice dropped, his gaze turning cold. Here, VIP patients are not for rookie nurses to handle. A tightness gripped Emma's chest. She had heard of Dr. Mitchell. His reputation for being strict was well known, but she hadn't expected him to be this openly condescending. Mr. Hayes remained seated, his expression unreadable. But Emma noticed a small detail. His fingers tapped lightly against the book's cover, a minor gesture. Yet something about it felt deliberate. Emma clenched her fist but kept her tone steady. I'm just doing my job. Doctor. Mitchell crossed his arms, his gaze sharpening. Your job, he scoffed. Do you really think a lowly nurse like you has the qualifications to care for my patient? His smirk deepened. You should focus on simpler tasks like cleaning. Perhaps, before Emma could respond, a quiet voice interrupted. Dr. Mitchell. Both turned to look at Mr. Hayes. He set his book down and asked calmly, what do you think of nurses like her? Dr. Mitchell hesitated for a split second before letting out a derisive chuckle. Those who don't belong in places like this shouldn't be here. Emma clenched her fist tighter. She could argue back, but she knew in a place like this, resistance was not always the smartest choice. Mr. Hayes looked at Dr. Mitchell for a moment longer, then suddenly let out a faint smile, a smile that was difficult to decipher. Emma didn't know why, but she had a feeling. This confrontation was only just beginning. The room was drowning in suffocating silence. Emma could clearly feel Dr. Mitchell's contemptuous gaze piercing straight through her. She clenched her fist but maintained a steady composure. This wasn't the first time she had encountered a doctor who enjoyed exerting authority over nurses. But there was something about Dr. Mitchell that unsettled her more than usual. It felt as if he wasn't just an arrogant doctor. He was someone accustomed to power, to having others submit to him. You think you can survive here without understanding the rules of the game? He crossed his arms, his scrutinizing gaze cold and unyielding. Emma took a deep breath, forcing her voice to remain calm. I don't know what your rules are, Dr. Mitchell, but I do know the principles of a nurse. To care for patients with professionalism and ethics. A sharp glint flickered in Dr. Mitchell's eyes. Clearly, he wasn't used to being challenged, especially by a new nurse. Listen, Carter, he deliberately emphasized her last name, an unspoken warning. Don't try to stand out. Here, nurses are just background figures. If you're smart, you'll know how to keep your head down. Emma felt an invisible weight pressing on her chest, but she refused to let it show. She gripped the patient file tightly, struggling to suppress the rising frustration within her. She had met many doctors with inflated egos, but Dr. Mitchell was something else entirely. He didn't just look down on nurses due to hierarchy. He genuinely believed they weren't worthy of respect. Outside in the hallway, a few hospital staff passed by, casting uneasy glances into the room. No one dared to step in. Everyone knew exactly what kind of man Dr. Mitchell was. In this hospital, he held power, and he wielded it to keep those beneath him in check. But before Emma could respond, a firm yet steady voice suddenly cut through the tension. Dr. Mitchell. It wasn't loud, but it carried an undeniable weight that made the entire room still for a moment. Emma turned toward the voice. Mr. Hayes, the patient she had been assigned to, was now resting a hand on the bed railing. His gaze locked onto Dr. Mitchell with a calm yet piercing intensity. Doctor! Mitchell turned, momentarily stunned, as if he had forgotten the patient was even there. Mr. Hayes, I didn't mean... You think nurses aren't important? Hayes tilted his head slightly, his voice steady but laced with an unspoken challenge. Doctor, Mitchell scoffed, but quickly regaining his composure. I just think those who aren't competent enough shouldn't be here. Emma remained silent, but she noticed the faintest smirk tugging at the corner of Hayes' lips. A quiet, almost mocking smile. Is that so? He said slowly. Then perhaps I should reconsider the medical staff in this hospital. Doctor, Mitchell stiffened ever so slightly. A thick, uncomfortable silence fell over the room. Emma didn't know exactly what was happening, but one thing was clear. Dr. Mitchell was not the only one with power here, and perhaps she wasn't as alone in this confrontation as she had thought. From that day on, Emma quickly realized that Dr. Mitchell's hostility didn't stop at mere words. It started with subtle but deliberate changes. Her shift schedule was constantly disrupted. Her patient assignments were suddenly transferred without explanation. And worst of all, some colleagues began to distance themselves from her. At first, Emma thought she was overthinking it. But when she noticed nurses whispering as she walked by or falling silent when she approached, she knew Dr. Mitchell had made his move. That morning, Emma was reassigned to the hospital's medication storage. Her usual shift involved patient care, but today, an administrative order appeared on her desk, instructing her to conduct an inventory of the pharmacy stock, a task far outside the responsibilities of a registered nurse. Emma stared at the order, then took a slow breath. She wasn't naive. This wasn't just a routine reassignment. He wanted to push her to the bottom. But if Dr. Mitchell thought these petty tactics would break her, he had miscalculated. Under the harsh fluorescent lights, the Grandview Hospital basement pharmacy felt eerily cold and desolate. The air was thick with the scent of antiseptics and chemicals, making Emma wrinkle her nose with every breath. Towering shelves lined the narrow room, stacked with boxes and bottles of every size. Some were old, coated in dust, forgotten remnants of stock left untouched for years. Emma sighed and rolled up her sleeves. She scanned the inventory list, methodically pulling out boxes, checking labels, and scribbling notes. It was mind-numbing work, the only sounds being the scratch of her pen and the faint rustling of cardboard. Then, something made her pause. On the inventory list, she spotted a familiar name, a drug that had been recalled years ago. She frowned. This medication was no longer in use, so why was it still in stock? And why in such large quantities? Her heartbeat quickened as she rifled through the shelves. Within minutes, she found the listed batch. The boxes were neatly arranged, their packaging intact, but something felt wrong. Emma picked one up, turning it over, her eyes locking onto the batch number printed on the label. A deep unease settled in her stomach. Without hesitation, she pulled out her phone and snapped a picture of the lot number. She couldn't ignore this. But what troubled her more was the question lingering in her mind. Who had kept these drugs here? And why? A bad feeling crept up her spine. That afternoon, Emma returned to the VIP ward. She wasn't sure why, but after hours of being relegated to the basement, she felt the urge to check on Mr. Hayes. His room door remained closed. She knocked lightly. "Come in." His voice was as steady and composed as always. When Emma stepped inside, he was reading as usual. But this time, he wasn't just looking at her, he was studying her. "Where have you been all day?" Emma blinked. "You noticed." Mr. Hayes gave a faint smirk. "I make it a habit to notice small details." There was something in his tone, but she didn't press. Instead, she silently checked his blood pressure. "How are you feeling?" "The same." He set his book down and met her gaze. "But I have a feeling." "You're not." Emma hesitated. She hadn't planned on telling him about her reassignment, but something in his expression made it hard to keep things from him. Mitchell sent me to the pharmacy storage." Mr. Hayes nodded slightly, as if this didn't surprise him. "And what did you find there?" Emma hesitated again. For some reason, she had the sense that he had been expecting this answer. "Just some things that didn't add up," she replied carefully. He didn't press further, but he smiled, a smile Emma couldn't quite decipher. Then, he simply said, "Be careful." Emma, that night, Emma's phone lit up with a message from an unknown number. Stop digging into things that don't concern you. She stared at the screen. One thing was certain. Dr. Mitchell wasn't the only one who wanted her gone. The anonymous message still lingered on Emma's phone screen, its chilling words like an unspoken threat. Stop digging into things that don't concern you. Her heart pounded, but she quickly regained control. Someone didn't want her investigating the pharmacy storage. She could choose to ignore it and go on with her job. But that wasn't who Emma was. The next day, Emma returned to the pharmacy storage. This time, she wasn't following an inventory list. She was looking for something else. The medication logs. Flipping through the records, she quickly noticed several irregularities. Recalled drugs were still being prescribed. Expensive specialty medications were recorded as received but showed no signs of ever being used. VIP patients were listed as recipients of certain drugs, but their medical records indicated they had never been prescribed them. A chill ran down Emma's spine. Someone was manipulating Grandview Hospital's pharmaceutical system. She hurriedly snapped photos of the records as evidence. But just then, "What are you doing here?" A voice rang out behind her. Emma's breath caught. Dr. Mitchell. The room suddenly felt stunning. Dr. Mitchell stood in the doorway, hands in his lab coat pockets, his gaze sharp as a knife. Emma tightened her grip on her phone, forcing her voice to remain steady. "I'm reviewing the pharmacy logs." "Doctor." He stepped forward, his eyes sweeping over the scattered files on the table. "And you think a lowly nurse like you has the right to access these records?" Emma took a deep breath and held her ground. "I'm just doing my job. If something is wrong, I believe the hospital board would want to know." "Doctor." Mitchell let out a quiet chuckle. "You think you can go against me?" He leaned in, his voice dropping to a dangerous whisper. "You have no idea what you're getting yourself into." "Carter." Emma clenched her fist. No, he had no idea who he was dealing with. That night, Emma made a decision. She needed advice. She went to see Mr. Hayes, but when she stepped into his room, she found something unexpected. Gone was his usual composed demeanor. A doctor she didn't recognize was checking his blood pressure, and Miss Hayes looked visibly weaker. "Is everything okay?" "Mr. Hayes," she asked, concern creeping into her voice. His sharp gaze met hers, more intense than she'd ever seen before. "I think it's time." Emma frowned. "What do you mean?" He didn't answer immediately. Instead, he gestured for the doctor. Once the door shut, he spoke carefully. "Emma, do you know who I really am?" She hesitated at the odd question. "You're Richard Hayes, my patient." Mr. Hayes gave a small smile, but there was no humor in his eyes. "Not just that, I am one of Grandview Hospital's largest shareholders." Emma's entire body went rigid. But what he said next stunned her even more. "And I know about the illegal drug operations happening here." The room felt deathly still. Emma held her breath, waiting for him to continue. "I've had my suspicions for a long time, but I never had proof." He met her eyes. "Until you found it." Emma felt a cold sweat forming on her skin. "What do you want me to do?" Mr. Hayes studied her for a long moment before asking one simple question. "Do you have the courage to expose them with me?" Just then, the door burst open. Emma spun around. Dr. Mitchell stood in the doorway. But this time, he wasn't alone. Behind him were two men in black suits, their eyes devoid of warmth. Dr. Mitchell smirked. "You've gone too far." "Carter." A dangerous energy filled the air. Emma tightened her grip on her phone. In that moment, she knew. She either ran or she was silenced forever. That night, Grandview Hospital was in turmoil. News of the internal investigation spread like wildfire. The board of directors could no longer turn a blind eye to the pressure from a major shareholder like Richard Hayes. The next morning, an official announcement was made. Dr. Mitchell was suspended indefinitely. But the story didn't end there. Emma became the center of attention. The nurses and doctors around her began to look at her differently. Some with admiration, some with caution, some with fear. She didn't care. She just wanted to do her job well. A week later, Emma received a call from the hospital director's office. Taking a deep breath, she adjusted her uniform and stepped inside. Inside, the hospital director sat behind his desk, while Mr. Hayes stood near the window, his gaze seemingly lost in thought as he looked out over the hospital grounds. "Emma Carter." The director's voice was calm yet firm. "You did something no one else in this hospital dared to do." Emma remained silent, waiting. "We have reviewed the entire drug management system. Thanks to you, we uncovered loopholes that should have been addressed long ago." She glanced at Mr. Hayes, but he only gave a small nod, as if he had already foreseen this outcome. The director continued, "Would you like an opportunity?" Emma frowned. "What kind of opportunity?" 2 weeks later, Emma was promoted. She became the youngest head nurse in Grandview's VIP ward. A few months ago, this would have been unthinkable. But now, she understood justice wasn't something distant. It simply needed someone willing to stand up and fight for it. On her first day in her new position, Emma walked into the hospital with a completely different presence. She was no longer the young nurse who was looked down upon. She was no longer someone pushed to the bottom just for speaking up. She was Emma Carter. Yendanem Carter, the one who had changed Grandview forever. And she knew, from this day forward, no one could ever trample on her again. Message of the story: never underestimate someone based on their appearance. Patience and integrity will always prevail over tyranny. Justice often comes in the most unexpected ways.